All right. Thank you all so much. My name is Timothy Jackson, Senior Director of Policy and Advocacy at AIDS Foundation Chicago, pronouns he, him. And I am responsible for facilitating tonight's webinar related to AFC's 2024 State Legislative Policy Priority Agenda. And so I am going to go over all 9 of our policy priorities. Yes, there are 9 of them. And so just want to let you all know, again, we are recording tonight's webinar. And we're going to provide some information towards the end on how you can get engaged in our work, as well as some additional information around Advocacy Day that's coming up in 2 weeks from today, believe it or not. And then we'll do some other housekeeping towards the end. Make sure, though, that you use the chat if you have any questions, the chat or the Q&A, and we'll be more than glad to answer those. Hopefully, I can get through these pretty quickly, so that'll leave us some time for questions towards the end. So make sure you're putting your questions in the chat, and we will go from there. So without further ado, let me share my screen. All right, can everyone see my screen?
Yes.
Great, thank you, Nadine. All righty. So do I want to start it again? We're talking about our policy priorities. These are state policy priorities. Essentially, just to go over this, really to provide some structure, foundation to these policy priorities that we're talking about. We initiate our policy priorities development process, usually beginning sometime mid-summer into early fall, where we conduct a number of stakeholder listening sessions, whether that be with people living with vulnerable to HIV, people impacted by homelessness, healthcare and social service providers, advocates, case managers, many others. Many of you all have attended some of these listening sessions. And really the goal of that is to really try to hone in on what are you all seeing on day in, day out, things that are impacting our communities, things that we can look at from a policy standpoint to correct some of these issues that our communities are facing. Whether they be barriers, whether, just things that you all have noticed that we can look at from a state policy solution standpoint. And so we take all of that information, and that really guides and undergirds really what our policy agenda looks like on a yearly basis. It also operationalizes AFC's intentional anti-racism work and understanding that racism is a public health crisis. So what does that mean? That means that we won't end the HIV epidemic. We won't end homelessness in Illinois unless we are being very intentional about our efforts around ending and dismantling racial health disparities, specifically when it comes to the communities most impacted by HIV and homelessness. And so being very intentional in those efforts. And then the other side of that is also being very intentional about our efforts to fulfill the goals and priorities of the statewide plan to end HIV, Getting Zero Illinois. So just want to kind of lay that as the foundation for our work. I also, before we go to the first of 9 policy agenda items, I am battling a cold, well, the remnants of a cold. So if you hear like I'm chewing on something, it is a cough drop. So apologies for that. So I won't be hacking on you all through this entire webinar. So we are about mid-session right now. This week, the General Assembly is not in session, but the spring session began January 16th, and really understood kind of one big thing was the weight and the impact of primary elections, which were last Tuesday on the 19th. And what we saw was we had 2 incumbents lose, one in the Senate, one in the House. Representative Mary Flowers, long-serving Black state representative, lost in a primary, and the appointed Senator Natalie Toro, the 20th District, lost in the primary as well. And so we know we're going to have 2 new members of the General Assembly coming, at least 2 new ones coming in next session, beginning next January. So understanding that. And then also understanding the way they crafted the calendar is that most of the days for this session are after March 19th, which was really, really good at the beginning when it was before March 19th. But now we're on the back end of March 19th, which means that Tim and my colleague Aces will be in Springfield a lot because business will definitely pick up. Some of the pressing issues that we're still kind of seeing, obviously, the state budget looms big. Understanding that right now the state is facing a $900 million budget shortfall, could potentially be more. And so obviously that's huge. The ongoing migrant issue, whether the state is going to provide additional funding to address that here in Chicago. And then really the continued discussion of the health benefit for immigrant adults and health benefit for immigrant seniors programs, which we will touch on in just a moment. So to start with, the very first policy priority is one where I talk about all the time. We cannot be successful in ending the HIV epidemic in Illinois unless we have the resources to be able to do so, meaning money. And it's all about the money. So House Bill 5667, Senate Bill 3809 is what we call our Strengthening and Protecting Illinois' HIV Funding Infrastructure, or SPIFFy 2.0. And essentially what this is our appropriations vehicle with all of the HIV funding ask in one bill. The reason why we do this is, one, it provides something for legislators to be able to refer to. But then two, it's easier to have all of these asks in one bill. So it's just really easy for them. It's easy as they're crafting the budget to be able to lift this information directly from this bill language, plop it in the budget, which is what we prefer. And so what we're looking at this year includes $4.5 million in investments to the state's HIV funding infrastructure in the state's fiscal year 2025 budget, which begins July 1 of this year. Excuse me. And so that 4.5 is broken into two main pots. One is the HIV lump sum. The HIV lump sum, for those that are not familiar, it is the state's largest pot of money related to HIV. And it is like your junk drawer at home. It contains a little of funding for just about everything, from HIV testing to treatment to ADAP to salaries to a little of everything. Right now, it is currently at $25.5 million, has been level funded for the past 3 fiscal years. And so we're asking for a $2 million increase to this. We are also asking for $2.5 million in a new line item for the Rapid Start for HIV Treatment pilot program, of which I will talk about in our second policy priority in just a moment. So those are the two big funding asks, $4.5 million for these two programs, in addition to protecting the funding for all of these other programs. So whether that's for GTZ Illinois, which is currently funded at $5.5, the African American HIV/AIDS Response Fund is currently funded at $10 million, and we're actually doing some additional advocacy to make sure that money gets out as quickly as possible. That money goes directly to Black-led HIV service organizations. So when we're talking about being intentional in our efforts to make sure that the communities most impacted by HIV gets the funding, this is kind of what we're talking about. Prep for Illinois program and STIs. Those are two new line items that was included in the state's fiscal year 2024 budget that we were able to get last year. Prep for Illinois is a program that provides PrEP and ancillary services to underinsured and uninsured Illinoisans. And so we want to make sure that we have that funding. And then STIs is $500,000 is the first funding dedicated specific to STIs in the state budget. We're proud to work with Representative Han Nguyen, Senator Mike Simmons, and many other of our HIV champions on these asks. One other thing that I want to mention is anytime that AFC is advocating for money, we are not advocating for AIDS Foundation Chicago. We are advocating for money for the entire HIV structure. So that's the reason why we say the HIV funding structure. No money is coming directly to AFC from any of our asks that we're doing. And so I want to be very, very clear in going through that. Our next big policy priority is House Bill 5417, which is our Connection to HIV Testing and Linkage to Care Act, or HIV TLC. And so essentially we understand that we, again, cannot be successful in ending the HIV epidemic if we do not increase connection, HIV testing, especially prioritized in the communities most impacted by HIV, and then making sure that we link them to care, those that are newly diagnosed and have fallen out of care. And so this bill is really geared towards addressing some of these issues. So it really contains three main reforms. At-home HIV testing kits. So it mandates that insurers and Medicaid provide coverage for home test kits for STIs, including HIV, without cost sharing. So basically what that means is without a copay. And so you should be able to get those, whether at a pharmacy, your doctor's office, or whatnot, without a copay if this gets passed. The next part is Rapid Start Pilot, which I alluded to just a moment ago, that $2.5 million we're asking for. What we're looking at doing is creating 8 Rapid Start for HIV treatment pilot sites that will initiate antiretroviral therapy within 7 days of initial diagnosis or within 7 days of referral to HIV care. And if you can look at the graphic towards the bottom, at the bottom of this slide, that's literally the HIV care continuum. And so that really highlights the importance of making sure that we get people diagnosed and linked to care and retained in care as quickly as possible. Right now, the state's standard of care is get people newly diagnosed onto the state's ADAP, which is the AIDS Drug Assistance Program, within 30 days. What this program would do would get people into ADAP within 7 days. And so this is the reason why it's so critically important that we do this, because a lot can happen in 30 days. And so we want to make sure that we're not losing anyone, who, especially those who are newly diagnosed, and making sure that we get people linked to care as quickly as possible. And then finally, there's the HIV education in county jails portion. And essentially right now, state law, State's County Jail Act, states that there should be HIV education, HIV AIDS education provided in county jails to people who are incarcerated, as well as their visitors, as well as an opportunity to link them to HIV testing. And so basically what this is doing is trying to get an understanding, an accounting of what county jails are currently doing it and what county jails aren't. Because right now we're not able to kind of ascertain that information. And so we don't know how to best help the ones that aren't currently doing it if we don't know who's not currently doing it. And so that's really, it's a very simple part of the bill, but it's something that is very, very important. We are proud to be working with Representative Kelly Cassidy and Senator Lakeisha Collins on this bill. This bill was voted out of committee last week, unanimously on a bipartisan roll call, which we were glad to hear. And so we want to thank, many of you all slipped in support. Thank you so much. We had well over 100 witness slips in support, so thank you. This bill, because we are working with IDPH, the Department of Public Health, as well as the Illinois Sheriff's Association, as well as insurers, on a couple of parts of the bill that will make it more implementable, if that's a word. And so the reason why that's important is it does no good for us to pass a piece of legislation that we can't implement. And so we have been having a lot of discussions with the Sheriff's Association or the insurers or the Department of Public Health and others, that have provided, some input on, well, hey, could you all change it to this so we can then be able to do this? Or have you thought about this to change it to this? And so that is a painstaking process, but we hope to get that amendment filed this week. So it will be in committee next week, So stand by for another witness slip call sometime the beginning part of next week. And so that's currently where we are with House Bill 5417. The next one is PDAB, Prescription Drug Affordability Board, House Bill 4472, Senate Bill 3108. And as you can see from the graphic, it's something that is so important. Drugs don't work if people can't afford them. And that is as simple as it can get. And it is an absolute value at AIDS Foundation Chicago that prescription drugs are too high, and that people living with and vulnerable to HIV and other chronic conditions should not have to be borrowing from Peter to pay Paul in order to get prescription drugs that they need in order to live. That is a value. And so we are proud to work on this legislation in partnership with Citizen Action Illinois, Protect Our Care Coalition, on a bill that would establish a prescription drug affordability board, independent, nonpartisan body that basically would set the authority to evaluate high-cost prescription drugs and set upper pay limits on what Illinoisans will pay. And so understanding that it's going to affect the entire supply chain from prescription drug manufacturers, wholesalers, PBMs, insurers, and pharmacies. And understanding that this issue is not an issue that is unique to Chicago or Illinois. It is a United States issue. And understanding that, a large majority of people are not getting the drugs that they need in order to live because of the cost. And so a recent survey that we had done about this, 86% of Illinoisans are supportive of establishing a PDAB. And so anytime you're making large wholesale changes that this bill is going to do once we get it passed, is you're going to run into a lot of problems. You're going to run into a lot of pushback. And that's what we have been running into, to be completely honest with you. It has literally been full tilt since even before session began in mid-January. But we are up to the task. We hope to have this bill up in committee, if not next week. Hopefully we will get an extension of the deadline, which is the 5th of April in the House. So we can continue working with insurers and all of the other people that are against this bill, and continue working at it. This is something, this as well as the next couple of bills, show that this is not a once and done thing. AFC has been working on this issue since 2019, specifically on PDAB. And some of the other policy priorities that I'll mention. These are things that you work on for quite some time in order to get good policy passed. And so we are so proud to be working with Senator Kaler, Representative Syed, on this legislation. We will continue at it, and we will keep you all posted. House Bill 2, Overdose Prevention Sites Pilot. Understanding that in 2022, we had over 3,000 people lose their lives due to opioid overdose in Illinois, with 2,000 of those in 2022 occurring in Cook County alone. And so understanding that something must be done, right? And so what we are looking at specifically is that overdose prevention sites have been shown to save lives, reduce the spread of infectious disease such as HIV, viral hepatitis, and then there's an opportunity for us to link those with substance use disorders to behavioral and physical health care, as well as other support services. So specifically what this bill would do is create one overdose prevention site pilot, one on the west side of Chicago, as well as connect people to community support, other existing medical care, recovery programs, harm reduction services, and understanding that what we're currently doing is not working. We know this, and so we have to do something different. And so ACE's Lyra, my colleague, is leading our efforts on this bill and working in consultation, coordination with the Illinois Harm Reduction and Recovery Coalition, as well as our bill sponsor, State Representative LaShawn Ford, State Senator Sarah Feigenholtz, on this bill. This is the third year that this bill has been in Springfield. So this is just, again, echoing that sometimes it takes a little longer. It's completely normal. Of course, we would love it to be faster, but this is, part of the thing. And it also really kind of shows that sometimes you have to kind of readjust. You have to reassess kind of your process. And so part of that is understanding that this bill is running into problems down in Springfield, understanding that. So what ACES has been able to do, and thank him for his leadership on this, is really kind of understanding that we need to do some education. A lot of education. So basically it's creating this Harm Reduction Solidarity Week that will be held April 14th through the 20th. ACES has been able to draft House Resolution 665 that's been filed by Representative Ford that seeks to recognize Harm Reduction Solidarity Week. Harm Reduction Advocacy Day scheduled for April 17th. And that week will also include a legislative briefing as well as an on-site OPS demonstration on the grounds of the state capitol in Springfield. Again, this is a part of the process of engaging stakeholders, reassessing, and figuring out how you can make this information more palatable to get more people on board and get it passed. And so that's really House Bill number 2. Healthy Illinois for All. It is, it's like a broken record. Another issue that we have been working on for quite some time. AIDS Foundation Chicago is a member of the Healthy Illinois campaign that has been working for many years to secure healthcare coverage for all low-income Illinoisans, regardless of immigration status. And so several years, beginning in 2020, we've been able to secure Medicaid-like coverage, for undocumented immigrants, beginning in 2020, from ages 42 and older. And so right now, there is still a gap. Right now, undocumented immigrants are not covered, Medicaid-like coverage, in this program from ages 19 to 41. And so what AFC and the Healthy Illinois campaign supports is full funding of both of these programs. The health benefits for immigrant adults, which is 42 to 64, and the health benefits for immigrant seniors, 65 and older, in the state's fiscal year 2025 budget, as well as reopening enrollment in these programs. The enrollment has been capped, and so we really want to reopen that enrollment to make sure that we are leaving no one behind. And what we have seen beginning in February is a transitioning of those that were in these programs from fee-for-service to the Medicaid Managed Care Organizations, or the MCOs. During his 2024 State of the State address, Governor Pritzker announced that in his budget for fiscal year 2025, he included $629 million for funding for the current program as they are. Does not include the program reopening at this moment. And that is a bump up in funding compared to what was funded the previous year, which was about $565 million or so. And so that's kind of where we are right now with Healthy Illinois for all. There isn't a legislative bill. There's not a bill for this, which again is normal. It's already in the budget, and so what you will have are advocates doing a lot of work on behind the scenes with legislators, with budgeteers, to make sure that the money for this program stays in the budget, right? And so we will be a part of those efforts, as well as you all will be once we unveil our mobile action network on April 10th for Advocacy Day. Excuse me. Also, let you know that with some changes coming up beginning April 1st, HFS, which is the State Medicaid Agency, will initiate annual redeterminations for those that are enrolled in both of these programs. And so there will be some changes regarding those, specifically for those who have green cards or lawful permanent residents. And so just be mindful of that. And so we are so proud to work alongside our legislative champion, Senator Omar Aquino, on this and many others to continue working on Healthy Illinois for All. And again, this is another value that for AFC, that healthcare is a human right. It is not a privilege. And so, it is something that everyone is owed. And so that is a very strict value of AFC, and ACES leads our efforts on Healthy Illinois for All as well. Okay, the next one, House Bill 5395, Senate Bill 3739, is the Healthcare Protection Act. So this one may be new to you all. Don't know if you saw when we announced AFC's initial policy priorities in mid-February. It looks a little different, but what we're looking at now, give me just a moment. Let me take a sip of water. Is House Bill 5395 includes a number of healthcare insurance reforms, including banning of junk plans or short-term limited duration junk plans, because we know that those type of plans deny coverage for people with chronic conditions like HIV and result in higher premiums. Ban prior authorizations for mental health in inpatient hospital settings for mental health treatment for adults and children. The banning of ghost networks, requiring that insurance companies conduct internal audits to ensure that their provider directories reflect the reality of healthcare that's available. Rate review for large group plans. We were able to work on rate review for small group plans and got it passed last year. And so we're going, again, another bite of the apple to get large group plans, and requires insurance companies to obtain prior approval from the Department of Insurance before large group plans can hike rates on consumers. And then premium realignment requires premiums to actually align with the actual costs of providing healthcare insurance. And so our initial bill that we were working on was Senate Bill 2836, and it was only about banning of short-term limited duration junk plans. However, this is House Bill 5395 is an initiative of the governor. And so basically our little bill was lumped into a much larger bill with other things that we support, and stands a very good chance of getting passed. You don't see that very often, where the governor basically uses the bully pulpit of his office to pass large, big pieces of legislation like this. So it is absolutely awesome for us to be able to have one of our policy priorities to be included in that. We are working with a number of different coalitions, member, community organizations on this, with our bill sponsors, Representative Anna Moeller, Senator Robert Peters. And just to kind of give you a little insight, again, broken record, AFC worked along Protect Our Care Coalition in 2018 to pass legislation limiting junk plans to 6 months of coverage. So again, that just shows, again, that these are you're in it for the long haul. And so this bill was able to get out of committee last week on the 21st. And so as you can imagine, because there's a lot of insurance involved in this, that there will probably, I would be shocked if there's not any further amendments to this bill. But again, even that is normal. And so we will just keep an eye on that. And we'll keep you all up to date on kind of where we go with the next steps on that. Excuse me. The next one is funding to prevent and end homelessness. AFC and the Center for Housing and Health, our subsidiary organization, proud to partner with community partners like Housing Action Illinois, Chicago Coalition for the Homeless, the Illinois Shelter Alliance, and the Supportive Housing Providers Association, or SHPA, in this advocacy where we understand that housing is healthcare, especially the people living with the vulnerable to HIV. And so essentially housing advocates will be asking for $85 million in new funding in the state's fiscal year 2025 budget. And those funds will be prioritized among homelessness prevention, emergency transitional housing, homeless youth programs, and supportive housing and other priorities, really in all efforts to move us closer to the Home Illinois plan to end homelessness in Illinois. And so these are those efforts. Again, there is not a bill associated with this. So much like Healthy Illinois, it will be a lot of behind the scenes, talking to budgeteers, talking to legislators, making sure that this money shows up in the budget, in the final budget that's signed by Governor Pritzker. And so proud to be working with Representative Will Guzzardi and so many other legislative champions on this issue. Couple more, y'all. Senate Bill 2158, House Bill 3703, stop the revolving door from reentry to homelessness to prison. Again, when we talk about ending homelessness and ending the HIV epidemic, really what is at the heart of that is, how do we remove barriers, right? How do we remove barriers? It's not just enough to get someone a house or get people treatment. That's great. We definitely want to do that. But how do we remove the barriers that make people vulnerable to housing instability or vulnerable to HIV or any of these things? And so this is what this legislation really is. Current Illinois registry and housing management laws systematically displace, exclude, and reincarcerate people, disproportionately Black men with past convictions. And so what this legislation would do, reduce housing management zones from 500 to 250 feet. And once people find safe and stable housing, grandfather them in. Because right now what we're seeing is that literally you could have safe and stable housing, but if something, those change, you could literally be out of housing at the drop of a hat. That's not right. Again, the second part of this is repeal the extra weekly registration. Register people based on duty to register, not their housing status. Again, we want to make sure that people have safe and stable housing. And so, the extra weekly registration is not necessary. And then finally, make failure to register a misdemeanor from a felony. Again, we want to end the vicious cycle of getting people caught up in the criminal justice system. And so AFC is so proud to work in partnership with the Chicago 400 and others on this legislation. AFC's Housing Policy and Advocacy Manager, my colleague Dominique Chu, leads our efforts on this. And this is a critical part of getting the Zero Illinois housing is. And so this is a huge priority for AFC and the Center for Housing and Health as well. So we are proud to work with Senate Majority Leader Kimberly Lightford and Leader Camille Lilly on this legislation. And then the final one is House Bill 5051, which is ban on prior authorization in health insurance plans. Those of y'all that may be familiar with this, maybe you're not. Prior authorization is a requirement by health insurance plans for patients to obtain approval of a healthcare service or medication before the care is provided. And so essentially, again, I just talked about how do we remove barriers. Prior authorizations are barriers. The decisions for someone's healthcare should be between a provider and the patient, not an insurer, not anyone else. And so these prior authorization processes are oftentimes barriers to care. And we understand that prior authorizations impact, or cause delays in getting your prescriptions or getting testing, tested that you need to get done. And we know that those result in negative health outcomes. We know for people living with HIV, you can't go a week, 2 weeks without your medication. And so what we're trying to do with this legislation is get rid of those, specifically for health insurance plans for prescriptions prescribed to a patient for 6 or more consecutive months for insulin, HIV PrEP and PEP, and HIV treatment, viral hepatitis treatment, as well as hormone therapy medications, including but not limited to estrogen, progesterone, and testosterone. We are working directly with Representative Jennifer Laddish-Douglas, as well as our community partners over at Equality Illinois, Howard Brown Health, on this legislation, and understanding, again, how do we remove these barriers? Excuse me, y'all. Just want to let you all know, too, and this is completely normal, that House Bill, as of now, House Bill 5051 is our main legislative vehicle. However, there's a possibility that this could change. And there's a possibility that we could hop on to Senator Christina Castro's Senate Bill 3732, which includes a ban on prior authorization for chronic conditions, long-term conditions, mental health conditions that's been prescribed for 6 months or more. The reason why is that bill has already passed out of Senate Insurance. And again, for those of you that may not be familiar, getting anything out of Senate Insurance, excuse me, is very difficult to do. So again, this is trying to play the game. Excuse me, y'all. I apologize, y'all. Excuse me. So what's next? Advocacy Day in 2 weeks. Excuse me, y'all. I was trying to get through it all. And so what I need for you all to do are 3 things. One, if you've not already signed up, I need for you to pledge to participate. And the link is on the screen, but I will put it in the chat in just a moment. Also, my colleague Ayana will be leading next week's webinar, Advocacy Day 2024, Crafting Your Story, Tools for Advocacy and Systems Change. Excuse me, y'all. Apologies. So if you've not signed up for that, I would really encourage you to do that. Ayana does a great job anytime she does this presentation. So you are going to be, it's awesome. I would love for you all to sign up. And then finally, is the webinar evaluation survey. We always want to know how we're doing. If I said something that you like, put it in there. Other than my coffee. If you didn't like my coffee, put it in there. And make sure that you do that. That is a great way for us to take that feedback and get better as we do these type of offerings. So before we get to any questions, I want to give you my information. And then I'm going to stop sharing screen. So make sure you put my information if you have any questions. I think most of you all do, but if you don't. So I hope I want to see if anyone has any questions.
And there have been a few questions and comments in the chat, Tim, that I've been responding to as you've been going along. So great engagement there. And just want to note that Tim just dropped all the links that he just referred to, including, I'm trying to see. Okay, I'm going to drop the evaluation survey now as well for this one.
Yes, great question, Tyler. Yes, I will send out an email as I'm trying to catch my breath, y'all. I will send out an email that will include these slides, the webinar recording, links to all of our fact sheets for these bills. We have fact sheets for almost all of our policy priorities, with the exception of the funding for homelessness and Healthy Illinois, because they're not bills, so they're not fact sheets, but we have them for the others. And so you'll be able to get all of this information, and I'm going to send you the links to it, so you're not even going to have to go look very far. So yeah.
And Tim, we do, thank you for that. We do have a question that came through the Q&A. It says, in your experience, what major policy changes still need to happen to meet the Getting to Zero plan goals?
There are a number of them. I'm going to be honest with you. One of which is overdose prevention sites. Although it's gone down a little over the last year or so, A couple of years ago, we were seeing 1 out of every 10 new diagnoses was because of injection drug use. And I worry about our neighbors like, you know, in Indiana or those in West Virginia that have seen huge HIV outbreaks due to injection drug use. And so that's one of them is I believe we need to look at. Two is understanding that decriminalization of sex work is another one. And these are currently in GTZ plan right now. Another one is going back and getting another bite of the apple on comprehensive sexual health education. Right now, we passed the law in 2021, but we were not able to get a mandate. And yeah, and so again, when I talked about this stuff being the long haul, this is exactly what I'm talking about, meaning we're going to have to at some point go back at that and look at that as an option, because we're not going to be successful if our young people aren't getting the education that we know they need and deserve. And so those are just 3 off the top of my head that I can think of.
Thank you, Tim. Any other questions, y'all? Anything that needs clarification?
And just want to highlight, thank you, Nadine. Nadine put it in the chat, keep an eye out for the updated GTC Plan 2.0. And so, yeah, so that's great. So please be on the lookout for that. Another thing, just kind of, and I want to add this to the question that was asked earlier. And I can't believe I didn't lead off with this one. Because I talk about it all the time, is we have to do something about HIV-related stigma. And so I don't know exactly just yet what that looks like from a policy standpoint. But I truly believe we can have all of the money in the world, which I am for having. But until we address HIV-related stigma, for those that are living with HIV and those that are vulnerable to HIV, we're not going to be successful in getting this away.
All right, I'm not seeing any more questions, Tim.
All right. Well, I hate to use this terminology, but I would love to give you all some time back in your day. It's still light outside, so you can go and get your a late early evening walk in or something. But again, I am going to put my name and information in the chat. And if you all have any questions or anything, please feel free to reach out to me. And I'll be more than glad to answer them if I have the answer to it. And I will, if I don't, I can find someone who does. Well, thank you all so much. I hope that you all have a great rest of your day.
Thank you, Tim. Good night.